Hello, everyone. Today, our discussion topic is about a very common disease, which is gout. Gout is common for people who do not keep healthy lifestyle. It is a type of arthritis which caused by too much uric acid in the bloodstream. Uric acid is a waste product. If it builds too much inside your blood, it could form solid urate crystals and deposit in your joints, including elbow or knees or knuckles, and then cause severe pain and swelling on your joints. However, gout can be successfully managed if you change your lifestyle and keep a healthy lifestyle. So it is really important for people to start to recognize the symptoms of gout. Gout could repeatedly attack your joint and cause severe joint pain, swelling, and redness. And when it develops, it can deteriorate within a short period of time and really cause very bad pain. So it can happen suddenly, often overnight. The most common affected joint is the big toe, but gout can also be experienced in the feet, ankles, knees, elbows, wrists, and fingers. So all different joints it can affect. But the most commonly, gout affect your big toe. So if your big toe has severe pain, you should be very concerned. Like we said, gout occurs when uric acid, which is a normal waste product, builds up in your bloodstream and forms uric crystals in the joint. Your body makes uric acid when it breaks down purines. Purine is a substance found in your body and in some type of foods. So when purines accumulate too much in the body, it breaks down into uric, and the uric will also accumulate. Uric acid normally dissolves in your blood, is processed by your kidneys, and leaves your body through urine. However, if your body makes too much uric acid or your kidney cannot clear enough of it, it then builds up in your blood. This is called a hyperuricemia. So if your uric acid level is building more and more, it doesn't mean you will definitely have gout. As long as you start to receive treatment in the early stage, you can still control it. So what kind of people are at risk of gout? These people, including male, or have a history of gout, or have elevated levels of uric acid in the food, are very easily to develop gout. Especially people drink too much alcohol, especially beer, or eat a diet high in purine, such as meat, sweetbreads, offal, shellfish, and fructose. So these kind of people, if they consume a high amount of alcohol or they consume high amount of purine through some foods, especially meat or shellfish. Now, these kind of people are easy to develop gout. Or people who have kidney disease, because we said kidney now can filter the uric acid out of your body through urine. So if your kidney doesn't function properly, the kidney could not clear enough uric acid out of your body, then you could have that problem. So again, people who are easily to have gout include male include people with family history, elevated level of uric acid in the food, high amount of alcohol consumption, and a diet with high amount of purine, including meat and shellfish, or kidney disease. So when people have gout, what are the symptoms? So normally the common symptoms include intense joint pain, swelling on the joint. Skin over the joint part may look red and shiny. The joint may be also hot on touch. How do we diagnose gout? The doctors will need to do a physical examination, do a blood test to measure the amount of uric acid in your blood to properly define the disease. So if we have gout, how do we treat it? The first step in treating your gout is getting the pain and inflammation under control. So you could have pain relief medication. You could use cold pack and apply cold pack on your joint areas to relieve swelling. And definitely have enough rest. Especially quit alcohol, stop drinking alcohol, and stop eating the food high in purine. There are several medications can effectively treat the gout. One medication called colchicine is very effective in relieving gout symptoms. So to make a conclusion, if you want to self-manage your gout, remember these things. First, maintain a healthy body weight. Make sure your weight loss is gradual. And keep a healthy diet. Start to reduce the consumption of alcohol and avoid binge drinking. Drink plenty of water. Flush out the waste from your body. And always stay hydrated. Avoid or eating foods that contain high purines. Now, if necessary, talk with a dietitian to give your diet plan. Exercise regularly. At least 30 minutes a day of physical activity could reduce the chance of gout. And if you do find that your joint is very swelling and red or have a lot of pain over your joint areas, please consult with your doctor to find